Hello and welcome to the High Risk Pregnancy Training Academy, where ANMs, medical officers and specialists come together to learn about high-risk pregnancy conditions, share experiences and work together to ensure the best health outcomes for mothers and babies. Today, we are learning about the identification, treatment and management of the high-risk pregnancy condition, anemia. But first, let's meet our expert trainers.
Hello everybody, I am Dr. Karishma Thiryani, a consultant obstetrician and gynecologist practicing in New Delhi. Today we shall be talking about anemia, one of the most prevalent high-risk conditions affecting the pregnant mothers. But if anemia is diagnosed and treated on time, then its effect on maternal and fetal morbidity and mortality can not only be reduced but also reversed in some cases. Today I have with me Dr. Poonam Tara. Ma'am is a senior specialist working in the field of maternal and fetal health, practicing in Delhi. We shall together be discussing protocols for management of anemia, which can be used by the ANMs, medical officers, and also the specialist. These are highly focused protocols where we shall be discussing the conditions when an ANM should suspect anemia and when should she refer the patient to a medical officer. Under what circumstances will a medical officer refer this patient to a specialist? And when will a specialist refer back the patient to the medical officer and the ANM? Ma'am, please tell our audience, why is anemia such a high-risk condition in pregnancy?
The blood carries oxygen through the RBCs, which is the red blood cells.
Yeah.
And because of the hemoglobin which is in there, it carries the oxygen to different parts of the body. In anemia, the hemoglobin is less and therefore the oxygen carrying capacity becomes reduced. And this is what causes anemia. Now, anemia is a disorder which can both affect the baby and the mother. So, in fact, it is found, especially in Indian women, pregnant women, 50% of them are found to be anemic. And it results into perinatal mortality and the maternal mortality to the extent of 18 to 20%. So how it affects the baby is that the babies which are born to the anemic mothers can be low birth weight. They can have a preterm birth, which is the birth before 37 weeks, and they can even have an early neonatal death. And to the mothers, it can cause immense problems depending on what the grade of the anemia is. So it can be like fatigue, it can be feeling the heartbeat like palpitations, or even the shortness of breath called dyspnea. So not just that, it can also cause maternal mortality, which is the maternal death, especially if it's a moderate anemia and she bleeds a lot after delivery.
Yes, and ma'am, even anemia causes decreased resistance to infection.
Of course it does, yes.
It also increases the chances of postpartum depression in pregnant women.
Yes, it does. It does. Not just antenatally,
yeah.
but postpartum as well. It can have its effects on the baby and the mother.
So ma'am, please tell me, what are the points on history that a healthcare worker should remember so that he or she can suspect anemia and not miss a patient who is anemic?
It actually begins with a detailed history, which is to begin with the present history. That is the woman getting fatigued? Is the woman, once she gets up from sitting position, does she feel weak? Does she feel short of breath when she's climbing up a flight of stairs? She feels not being able to work as much as she could. So these are primarily the symptoms which the lady can present with.
Exactly, and the ANM and the medical officers can so easily ask the patient about these complaints. A simple basic question like, are you able to carry out your daily activities which you were doing initially? Yes. Such simple question can help you in, suspecting that the woman is suffering from anemia, isn't it, ma'am?
Of course. And also, then once you've known the symptoms, the current symptoms, you go back on the history and check how many deliveries has the lady had. So say, for example, somebody has more than 3, that increases the chances of her having anemia. And if the spacing between the 2 children are less than, 2 years or so, it again increases the chances of her having reduced hemoglobin.
Exactly.
So obstetric history, has she had any excessive bleeding just after the birth? Has she had any blood transfusions thereafter? Any history of fever with chills, which can suggest, malaria or low onset fever like tuberculosis. So all these have to be recorded very well.
And ma'am, what are the signs in physical examination and diagnostic tests which can help in early identification and diagnosis of anemia in pregnancy?
To begin with, it is just looking at the lady in general and making sure that the lady doesn't look very puffy. And also the eyes reflect a lot. So if the conjunctiva is showing pallor, or the mucosa, the oral mucosa is pale, along with the lips,
Yes.
Coming down to the nails, pallor is again very evident in women who have got severe kind of an anemia, including also the moderate anemia. Sometimes the nails can show like a spoon effect, called as cholionychia. So these are all symptoms suggestive of anemia. And then you go down and check the pedal edema, the edema over the shin bone, and make sure that's not there. Once the healthcare workers goes and checks everything, including the history, it would be difficult to miss it out.
And these are such easy signs to be seen, like
Yes.
pallor, clubbing, pedal edema. I think all healthcare workers should be trained
Right.
to look for these signs and how to identify them.
Exactly. And the moment the healthcare workers realizes that this is what it is, every visit they have the digital hemoglobinometer,
Yes.
which they can just take a little, prick of the blood
Yeah.
and report the hemoglobin in grams per deciliter. And depending on what it is, the grading of anemia happens. So, for example, more than 11 is a normal in Indian pregnant
women.
or pregnant ladies.
Yeah.
And less than 7 is severe. So these are the important parameters they should keep in their mind. Less than 7, refer to the medical officers, to the specialist. Okay, between 7 to 9.9 is a moderate anemia, which can be controlled to a certain extent by the healthcare workers, but may need further referral should there be a need for it. 9.9 to 10.9 is the mild anemia, which certainly can be looked after by the diet and by the supplements.
Exactly.
That can be given by the healthcare workers.
Basically, what the healthcare workers should remember is that they have to take a very thorough history, do a complete physical examination, including the vitals, the general physical examination, and do hemoglobin in every visit. A good and proper dietary counseling where you inform the patient about locally available iron-rich foods is very important.
Yeah.
Along with it, IFA tablets, which are available free of cost in most healthcare settings, are to be advised to the patient, and not just advised. The healthcare worker needs to counsel the women as to when she should take the IFA tablets, at what time. They should not be taken with milk. They should not be taken along with calcium. And what are the side effects, so that the compliance of the patient is there. Ma'am, what are the ways through which the healthcare worker can check for compliance in a woman?
So obviously, if the lady is taking it regularly, her hemoglobin is going to get better. So every week she has to, when the healthcare workers goes and sees the lady and does the hemoglobin, it should get slightly better than what it was before. The second thing is just a history. Does she have black stools?
Yes.
Black stools are a common thing with the iron tablets. So that is also suggestive of compliance. Before actually the supplements are started, it is also very important that the lady is aware that there can be certain side effects of it. Not everybody gets it, but if they are aware of it, they would like to continue with it. So side effects like nausea, vomiting, black stools. These are important things. Sometimes feeling dizzy as well. Constipation is very common. Some ladies have diarrhea, some constipation being more common. So side effects knowledge is important for the lady, for the family, so that they don't not take it. They understand it's a part of it, and their body can get used to it.
You just now told us that most of the cases of mild anemia can be managed through dietary counseling and IFA supplements. But are there certain conditions that the healthcare workers like ANMs and medical officers should know about? That is to say, danger signs, that when they should refer the pregnant woman suffering from anemia to a higher center?
When the healthcare workers checks the lady and finds that the pulse rate is more than 100 per minute, the respiratory rate is 24 per minute, it suggests that anemia is severe and needs to be referred. Hemoglobin, when it is less than 7, certainly needs to be referred. If the lady has been taking iron supplements and has not been able to increase her hemoglobin to a gram in the last 4 weeks, that needs referral as well. Any pregnant lady who has had problems taking the iron tablets would need further management in the form of intravenous iron, so that she needs to be referred. And any lady who has got anemia but also has other issues like the hypertension or diabetes would need to be referred as well to the higher centers.
So true, ma'am. So Dr. Poonam, all those women who are referred by the ANM and the medical officers to the specialist, will they be delivering with the specialist, or are there certain circumstances where the specialist can refer the patients back to the medical officers?
No, of course, the lady can be referred back to the ANM again. And that's important because the one-to-one bonding actually happens with the ANM who visits their home and knows the entire family as well as the pregnant lady.
Basically, all the healthcare workers should know that once a specialist has ruled out other causes of anemia and the hemoglobin levels are back to normal, the patients can be referred back to the medical officer or the PHC for delivery. Yeah. But there's another point which the healthcare workers should remember, that even when the patient is being monitored by the specialist or the medical officer, the role of the ANM is very important. Yeah. She still has to visit the family, take care of the nutritional needs of the patient, emphasize to the patient that she has to continue the treatment that has been started to her by the medical officer and the specialist. Isn't that right, Dr. Poonam?
That's very well put, Dr. Karishma.
Ma'am, now since anemia is so prevalent in pregnancy, will you like to elaborate on postpartum management of anemia?
Yes, so postpartum management again remains the same with the dietary counseling and the ferrous IFA tablets, which could be twice a day until they've reached 11, and then 11 grams per deciliter, and then it could just be once a day for another 6 months. If, for example, the hemoglobin is low and iron compliance is not there, the tablets, iron can be given as FCM injections, which is the ferric carboxymaltose. This has got very less side effects and can be given postpartum as 1,000 milligram in 200 ml of normal saline, which is a good number of doses to increase not just the iron for the current thing, but also the reservoirs of it. So that's one of the ways to increase the iron supplements, the iron reservoirs of the women.
So true, ma'am. Because if the woman is iron deficient or anemic even in the postpartum period, then wouldn't it increase the risk of postpartum infections,
yes,
reduced production of breast milk,
yes,
fetal infection in the baby?
Right. So to be able to keep up to the new baby and the newer requirements in the postpartum period of the mother, it's important that the hemoglobin is well, within the normal limits. And having just a dietary and the oral IFA can actually go a long way in the well-being of the mother and in actually the family.
Could you please give us a few takeaway points for our healthcare workers?
The important thing the healthcare worker should understand is that the bonding with the women is very important. The more the lady understands and shares with the healthcare worker, the better it is. It all starts with a very systematic information taking from the patient, which includes a detailed history taking, and here the questionnaire, the checklist box is very important. So ticking the boxes for the history taking is important, which includes the current history and the previous history, the obstetric history and other medical issues as well. The examination has to be done, particularly the pulse rate and the respiratory rate, and any evidence of pallor, of anemia needs to be looked into. Once it is done, hemoglobin should be checked, particularly at that visit and at every visit that the healthcare workers goes and sees the pregnant lady. It's also important that the correct referral, a timely referral is sent to the medical officers and the tertiary specialists so that it's dealt with in time. It's important that once the lady is referred back from the tertiary centers to the healthcare workers, the continuity of healthcare is maintained so that we have a healthy mother and a healthy baby, and this care lasts post-delivery as well.
Thank you so much, Dr. Poonam, for discussing the anemia protocol with us in such detail.
Thank you to our expert doctors for taking out time for this training on the identification, treatment and management of anemia during pregnancy. Thanks to them, we now know what anemia is and how to work together as members of the healthcare community to identify, manage, and treat anemia. Always remember, a pregnant woman needs to be referred up by an ANM or a medical officer to a specialist when she has multiple high-risk factors, shortness of breath, palpitations or abnormal vitals, unable to tolerate IFA, no increase in hemoglobin even after 1 month of IFA tablets, severe anemia, that is HB, less than 7 gram per dl. You can access the anemia protocol on the Amma Kosam app or look at the Amma Kosam high-risk pregnancy booklet. See you next time.